Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Thank you to the Borobudur International Symposium Committee for the opportunity that has been given to me. Introduce my name Arik Dian Eka Pratiwi and my teams Dimas Aditya Smara and Erna Prastia Ningrum. We come from the departments of Pharmacology and Clinical Pharmacy, Sekolah Tinggi Ilmu Farmasi, Yayasan Farmasi Semarang, Semarang, Indonesia. Today, I will present the results of our research entitled Description of Antiviral Usage in COVID-19 Patients at one of COVID-19 Referral Hospital in Semarang City. The point I will present this time include background to the problems, and then methods, and then research result, and the last is a conclusions. First, we will explain related to our research background. At the end of 2019, a new coronavirus disease 2019 or COVID-19 has emerged that causes severe pneumonia. Coronavirus disease 2019 or COVID-19 is a disease that attacks human respiratory system and can cause a pneumonia. COVID-19 is a new type of disease caused by the latest variant of coronavirus, namely severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2. The outbreak was first reported in Wuhan, Hubei province, China. As of early February 2020, more than 3 million cases have been confirmed and more than 200,000 have died. As cases in different countries continue to increase, World Health Organization or WHO declared it to be the first global pandemic caused by the coronavirus on March 11, 2020. This disease is a condition caused by a virus, and one of therapeutic treatments for COVID-19 patients by taking antiviral medications. From this background, the purpose of this study is number one is identify a description of antiviral usage in medication of COVID-19 patients. And number two, to identify demographic of the patient. And number three, identify the most antivirus usage. In this part, we will explain the research methods. This study is a retrospective observational study with data taken from the medical records of COVID-19 patients admitted to hospital from June to December 2020, where in that month, COVID-19 cases are very high. Here is our research flow. The first, we conduct a survey of research place. The study was conducted in March to August 2021. And then we take care of research permits, and then we set a inclusion criteria and data collection and analysis data, and then we discussion of research results. About the research inclusion criteria, consists of a patient diagnosed with COVID-19, and then a patient undergoing hospitalization, and a patient have full medical record data, patient getting antiviral therapy, and over the age of 6 years, and patient discharged from hospital in good health. From the result of the study, obtained as many as 105 medical record samples that fall into the inclusion criteria. Yeah. The research showed that men were more infected with COVID-19 than a woman. The age range of 18 to 50 years, about 47% in this study, was the highest number infected with COVID-19, followed by a range of 51 to 60 years, or about 37.1%. According to WHO, generally, this viral infection occurs at the age of starting at the age of 40 years. So it's expected that in that age ring, more guard yourself from a COVID-19 infection. Wulandari and her team states that men lack attention and knowledge in the prevention of COVID-19 disease than a woman. Locus in a woman can be attributed to protection from sex hormone and the X chromosome that play an important role in the adaptive and innate immune system. And about description of antiviral usage medication of COVID-19 patients, data analysis illustrate that favipiravir is the most widely used antiviral in both a single and combination therapies. While combination therapy, favipiravir and remdesivir is the most widely given antiviral by doctors. On COVID-19, antiviral administration for patients was adjusted to clinical condition, dose, and duration of medication. So my conclusion, the largest use of a single antivirus is favipiravir, and the highest antiviral combination are favipiravir and remdesivir. Antiviral administration for patients was adjusted to clinical conditions, dose, and duration of medications. This research was very useful to obtain information for pharmacists, especially those working in health service, especially in hospital, in monitoring therapy and the effectiveness of antiviral uses, so that they could help improve the patient conditions. Okay, this is my reference, and thank you for watching, and thank you for attention. Assalamualaikum warahmatullahi wabarakatuh.